There has been lots of discussion recently about variants of concern, or VOCs, and I want to address some common questions about what they are and how they can potentially impact our response to the pandemic. Genetic variations of viruses, such as the one that causes COVID-19, are common. The term variant is used to describe cases where there have been several significant mutations or changes to a virus. While most of these mutations will not have a significant impact, some may provide the virus with a specific advantage, such as the ability to spread more quickly. When there are significant mutations to the virus, scientists call it a variant, and when this affects disease spread, disease severity, the tests used to detect the virus, or the effectiveness of vaccines and treatments, it is called a variant of concern. Currently, there are 3 COVID-19 variants of concern circulating globally, and these have been identified in the United Kingdom, South Africa, and Brazil. All 3 of these mutations have now been identified in Ontario. So far, there are no signs of the variants causing worse outcomes at an individual level, but each variant seems to make the virus more infectious, allowing it to spread faster, ultimately causing more COVID-19 infections among people. In fact, we are hearing that in some cases, people who are exposed to variants become infectious within hours or a couple of days from being exposed, versus the more typical 5 to 7 days of incubation we had been seeing with COVID-19 previously. The federal government has a monitoring program to identify new COVID-19 variants in Canada, and the province is ramping up screening of COVID-19 cases for the variants. In Halton, we have adjusted some of our local public health response measures already. For example, our case and contact management staff are following stronger guidance from Public Health Ontario to rapidly identify those exposed to a person with COVID-19, especially a variant of COVID-19, and instruct them to isolate right away and get tested, potentially twice during their incubation period. If I can be clear about one thing, it would be this: no matter what level of the framework we are placed in, it is crucial that we all continue to make decisions that protect ourselves and others and the community. This includes recognizing that the risk posed by new variants of the virus are a serious threat. So please, I urge all residents to continue these actions. Stay at home as much as possible and only go out for essential purposes. Stick with your household and avoid all indoor and outdoor gatherings. And take your symptoms seriously, even if they are mild. If you have any symptoms, self-isolate right away and get tested. COVID-19 spreads easily if we let it. With these new, more contagious variants circulating, it is especially important for us to do our part to reduce the spread of COVID-19. As always, please make sure you are getting your information from reliable sources. Please visit halton.ca/COVID-19 to learn more about the virus, including the new variants, as well as information about testing and about local public health measures. Thank you, Halton, for staying the course. Please continue to stay safe and be kind.